Welcome back for the final unit of our training program. In this unit, we will briefly review the material already covered, discuss our options in setting up the model, emphasize the important role of the behavioral health specialist in making the entire model work, and summarize how we can make the model sustainable with appropriate billing. Dr. Abreu will start by briefly summarizing how the model can be put together.
In order for the integrative model to be self-sustaining, it is critical that appropriate steps be taken to establish an effective therapeutic team and institute the systems to secure adequate reimbursement. If you can accomplish this, you can improve the care of older adults and ensure a positive impact on your practice. After reviewing the materials in the previous sections, I am sure you realize that the integrative model is designed to be delivered by a team of providers. The model relies on two major players, the primary care provider and the mental health specialist. A very simple team would consist of these two providers delivering the entire program. The primary care provider would screen, evaluate, counsel, and refer, provide medication management if indicated, and be available for medical consultation. The mental health specialist would do the formal diagnostic assessment, develop a treatment plan in consultation with the provider, deliver the problem-based therapy, and provide supportive services and program evaluation. A more likely model would have the providers delegating some of the responsibilities to others. This could be a medical assistant doing the screening, a nurse practitioner doing the medication management, or a social worker providing supportive services. The role designation will depend on the nature of your individual practice. However, some roles cannot be delegated. The physician must interpret the results of the screening tool and make the referral to the mental health specialist. The physician is also responsible for managing medication therapy for any mental health diagnosis or supervising the medical assistant, nurse practitioner, or clinical nurse specialist if they are providing follow-up care. Making the diagnosis and providing problem-solving therapy is the responsibility of the mental health specialist. There are two ways to put together the treatment team. If your practice has a mental health specialist on site, they can provide the diagnostic and therapeutic services. This is known as a carve-in or co-location model. You can also deliver the program by using the services of a mental health specialist that is off-site in a specialty mental health clinic or private practice. This is the carve-out or referral model.
Even though the entire process is a team effort, the behavioral health specialist should be involved in every step. Take a look at the table on the screen as we review the four clinical elements of the collaborative model. Screening is the first step. Often the behavioral health specialist will do the screening as the model is being implemented and turn over this responsibility to a nurse or other clinical staff member as they become more comfortable with the model. The responsibility for completing the diagnostic assessment will fall to the behavioral health specialist or someone under her direction. Treatment will include both medication management and problem-solving therapy. Support services should also be considered in the treatment phase. While medication management is the responsibility of the physician or other primary care provider, such as a physician's assistant or a nurse practitioner, the behavioral health specialist will provide or oversee the other treatment components. Evaluation will be performed on a regular, scheduled basis and will be used to assess patient progress and modify the treatment approach when necessary. Evaluations will be completed by the individual who has provided that component of the treatment, with the physician and behavioral health specialist sharing ultimate responsibility for this step. As a patient moves through each of the steps in the model, there are opportunities to obtain reimbursement for those services. Dr. Abreu will give a brief overview of how this can be done.
Regardless of how you build your team and obtain additional support, it is possible to make the integrated model financially sustainable through appropriate use of the billing process. All four of the key elements of the program, screening, diagnostic assessment, problem-based therapy, and medication management, are reimbursable. Since our older clients are primarily covered by Medicare, most claims will be billed to that program in the usual fashion. Exceptions would be those individuals that have dual eligibility, covered by the Medicaid elderly waiver, or are seen in a federally qualified health center. Even though the reimbursement process is different for these patients, the billing codes and required paperwork are the same as for Medicare. All of this is made easier because the completed screen, assessments, and other paperwork that are part of the integrated model will serve to document service and support the billing process. In order for the model to work financially, a treatment plan needs to be created and documented. Completing the treatment plan form that is part of the model does not require a great deal of additional time. Patient evaluation is the final component of the model. At 4, 8, 16, and 24 weeks, the mental health specialist will re-administer the instruments that were initially used to provide a diagnosis. Medication management is also completed at these intervals. Documentation of the findings at these visits will support the billing process and serve as a measure of the integrated model's therapeutic value. This documentation provides the means to capture charges for all of the elements of the integrated model. Examples of billing opportunities that arise from the model and can be captured include upcoding to reflect an increase in the intensity of the physician's service, and would also include the additional unique visits arising from the diagnostic, treatment, and evaluation aspects of the integrated model. By documenting the treatment plan and charging for additional services where appropriate, these extra receipts will keep the model financially viable. Please refer your billing personnel to the materials in this section for complete details.
I want to share with you a few more details about obtaining reimbursement. You do not need to become an expert on this, but it will be helpful for you to understand how you can make the model sustainable through appropriate billing. You can see that all 4 steps of the integrative model are presented in the table. Each can be billed to Medicare. The table shows each step in the model, which providers are qualified to perform the service, the treatment location, and the CPT billing code. The various billing codes are selected based on whether the patient is a new or returning patient and the type and complexity of the intervention. To show how this works, we can follow the line for the screening step. Screening can be done by several members of the team, but the primary care provider or the behavioral health specialist will be the provider of record for the billing. The screen will be performed in the primary care clinic, and the appropriate CPT billing code could be 99202, 99203, or 99204 if the patient is new to the practice and their presenting problems range from low to moderate to being more complicated. The table explains how the billing can proceed for every step of the model. It is important that everyone in your practice, from the physicians to the billing clerks, know that all of the patient encounters are reimbursable and that the documentation to support these claims is collected at each step in the model. Now I would like to have our behavioral health specialist, Nicole, return and talk about the critical role that you will all play in making the integrated model a success.
Hello again. I think it is fair to say that the success of the integrated model depends upon the behavioral health specialist. In addition to being part of the integrated team and providing clinical care, the behavioral health specialist must also take responsibility for ensuring that all of the pieces are in place to make the model run smoothly. Take a look at the following table as I describe what is going on between the lines of the steps of the model. Our first line is preparation. Make sure that you have all the supplies and information needed for the model to run smoothly. Begin by developing a process that will make sure that all eligible older adults will be seen in the clinic and screened. Whoever is doing this screening will need to have the forms, so make sure they are readily available. Develop and use a tracking system to document when the patient was screened, the results of the screen, and if they moved on to assessment if the screen was positive. The tracking system will also document the results of assessment, treatment, and provide reminders to schedule follow-up appointments for treatment, evaluation, or reassessment. The second line is provider and patient education. Even though primary care providers encounter individuals with behavioral health issues in their practice every day, as a rule, they do not have a lot of training in managing these patients. They also may be concerned that their patients might be lost to them if they participate in the model. It is a behavioral health specialist's job to inform the providers about the model and show them how it can benefit their patients and their practice. Some providers may actually have misconceptions about the behavioral health specialist, what they do, and the nature of therapy provided. You will need to assure them that all of the steps included in the model and the different tests used to make the diagnosis have been shown to be valid and reliable. Tell them exactly what the role of behavioral health specialists will play in each of the steps, and you will make them feel more assured about working with you. Emphasize that your role in the team will add real value. In particular, you need to remind them that the assessment is based on objective tests and that problem-solving therapy is concrete, problem-based, and time-limited. Reassure them that they will be included in all decisions made about the patient and that participants will continue to receive their usual care. Your ability to anticipate and answer any questions that the providers may have will solidify your place in the team and ensure the success of the model. As an older adult moves through the steps of the model, the behavioral health specialist must make certain that there's appropriate follow-up. Individuals that enter the assessment and treatment phases will be seen frequently and monitored appropriately. Those older adults who fall out at various steps will need special attention. If they screen positive but do not move on to assessment for any reason, they will need to be tracked and rescreened. Anyone that has a negative screen will need to be rescheduled for a repeat screen in 1 year. These measures will guarantee that any older adult that may be experiencing a behavioral health issue or who may develop one over time will not be at risk because of lack of follow-through. Taking an active role in monitoring will ensure that your patients are receiving the behavioral health care that they need. The documentation that is created will serve a number of functions. It is the basis for reimbursement. It will demonstrate to the patient that she is making progress and improving. If progress is slow, it will offer the information necessary to fine-tune treatment plans. And finally, documenting results will help the patient and the provider recognize the value of your contribution in the model as a whole. I hope we have made it clear how vitally important the role of the behavioral health specialist is to the success of the model. These responsibilities will present a significant challenge, but the rewards are also great.
Before we conclude, let's hear again from Dr. Abreu about some important aspects to remember.
I also want to remind you that there are 2 other ways to improve the way you treat older adults with behavioral health and late-onset psychiatric problems. One way is to consult with neurological and psychiatric specialists when problems appear to be too complicated or not responsive to treatment you have developed. Such professionals typically staff local hospitals and may already be aligned with your clinic on a consulting basis. Neurologists and psychiatrists often staff mental health clinics and should be available for your mental health specialists to contact as well. Now, having said this, we realize the number of physicians who specialize in geriatric neurology and psychiatry are limited and may not be easily accessible to your patients. Indeed, the lack of specialists is one reason why older adults typically rely on you so much for help with behavioral health and psychiatric problems, more often than you may realize. The second way is for you to keep learning. This 1-hour training was only meant to be an introduction to the provision of integrated care to older adults. You should make use of the considerable number of online training materials, professional conferences, and journal articles that address this topic in a variety of ways, such as focusing on providing care to unique groups of older adults or the effects of the latest pharmaceutical approaches. We all share the goal of improving the health and well-being of our older patients. Psychiatric and behavioral health problems in our patients can prevent us from reaching this goal. The problem is real. Many of your patients will suffer from behavioral health and psychiatric problems. It is significant as the number of older adults continues to grow. And it is manageable. Using an integrated approach has been shown to yield results. By implementing the integrative model, you will improve the outcomes for your older adults, you will save yourself and your staff time, and you will have a positive financial impact on your practice.
Congratulations! You have completed this video tutorial. We all look forward to the opportunity to improve the care of older adults with mental health problems. Thank you for your interest.